I'm Dr. John Chessare, the President and CEO of GBMC HealthCare. So the Affordable Care Act was an outstanding piece of legislation. Unfortunately, for the man on the street who's working hard and trying to get by with his family or her family, it's a very complex law. There are two big pieces of the legislation. One is about insurance, and the other one is about fixing the delivery system to generate more value for the American people. There has been no conversation about this second part that has been dramatically successful. We have never seen increases in Medicare costs per patient so low in the history of the program. The incentives have been changed to get doctors, nurses, and other clinicians to provide better value. I am very sad that the American public has heard nothing about that part of the law that has been an exemplar of change. Then we have the other big piece that does make it to the news about the insurance market. And everybody in public health school, like me, learns in the first week that the best system is community rating. What does that mean? It means you spread the risk over the entire population because you know you're going to have some poor individuals, like a very dear family member of mine who has seizure disorder. He didn't do anything to earn that seizure disorder. In the way the system was designed before the Affordable Care Act, my loved one was not insurable. I would ask my fellow Americans, is that fair? What did he do to earn his seizure disorder and to say you are not eligible for health insurance? So the Affordable Care Act set out to fix that. But if you want to insure the people that are already sick, you have to have large numbers of healthy people to spread the risk over. Some other countries have fixed this by using community rating and spreading the risk over the sick and the healthy. The Affordable Care Act set out to incentivize healthy people, most of them young, to buy health insurance. Unfortunately, not everybody bought it, and the more people that don't buy it, the more the price has to go up to cover the sick people. Every time the price goes up a little bit more people say, oh my God, I'll take my chances if I'm healthy and not buy it. What does that do? It raises the cost some more. So the part that needs to be redesigned is how do we get the healthy people into the market? And mark my words, the American people pay for the healthy people. The way they pay is as soon as the healthy person gets in a car accident, guess what? They have no health insurance. Who's paying? The citizens, directly or indirectly. So the idea of letting healthy people not have insurance is kind of silly. But it's also silly to try to put the sick people all in one bucket and somehow miraculously believe that that's going to make the overall costs lower. The problem is it's a chicken and egg situation. The American people won't listen because no one is breaking it out simply enough, and because no one is breaking it out simply enough, the American people will not sit still long enough to listen. So we get these stupid soundbite conversations that are really very sad. If your children did it, you would give them a stern lecture. And here we have adults trying to fix a complex problem by yelling things or saying, oh, we'll fix this by just giving it to the states to fix. Well, it doesn't actually fix anything. It just pushes the responsibility onto someone else.